Hi, my name is Erin Ayub. I'm a lifetime resident of El Paso, Texas, and I'm currently a senior at the University of Texas at El Paso studying computer information systems.
And I'm Liz Ayub. I'm a teacher in El Paso, Texas for the Socorro Independent School District. And we brought Erin here. I've been a lifetime resident of El Paso. Erin became ill, and so we brought her to the Mayo.
I started experiencing symptoms the last few weeks of my almost last semester of college. I didn't have any symptoms in high school. I was really healthy. I was doing kickboxing, I was doing band, I was doing ballroom dancing and all kinds of things, but the only symptoms I experienced were flu-like symptoms, so I didn't even know this was coming on.
She said she became ill at the beginning of December, and she was in the hospital in El Paso for 12 days. They couldn't diagnose what she had. So the intensivist there in El Paso suggested we bring her to Mayo, and we got here December 21st, and within hours after we got here, based on the symptomology, the doctors were able to diagnose it as Anti-NMDA Receptor Encephalitis.
My parents told me that I started having seizures. I started not being able to talk. I came home from school, I was taking my finals, and I was very upset I couldn't write my name. And that's really what I remember, what I've been told.
In El Paso, they, as I said, they couldn't diagnose her, and at that point she had quit breathing, she was having seizures, so they put her into a medically induced coma to try to stabilize her until they could figure out what was going on. When she was transferred here, as I said, she was in status epilepticus, and so they continued the induced coma. They had a very difficult time controlling the seizures. They had her on a total of 4 or 5 different seizure meds, and ultimately, as I understand it, it was the first time that they had used a ketogenic diet on a person her age to try to stop the seizures. And that's ultimately what stopped the seizures, and they were able to get them under control. But that took about 3 months. And at the end of 3 months, they started weaning her off of the propofol and Versed to take her out of the medically induced coma. But once they did that, she was still non-responsive. So what happened is Erin was a member of the Montwood High School band for 4 years, as was her brother. And we were very active when they were students in high school. And so we knew the band director very well. I was a teacher at the competing school, El Dorado High School, and so both schools came together and to support us, and I can't begin to tell you how much support both groups gave us, and it was really pretty amazing to see them come together in support of Erin.
When I started becoming responsive again, I was very confused. I really wanted to go home. That was my biggest thing. I wanted to go home. And I couldn't believe that I couldn't walk anymore. I couldn't do things I used to do. One of the big things that was shocking was I couldn't hear music. I could hear, if you're listening to a song and you hear a piano line, that's what I could hear, but I couldn't hear voices. I couldn't hear the bass drums or anything else. I could hear the piano line. And so watching movies and listening to music and all that kind of thing, all those things, they were lost, and I was very sad. But I could write, I could still write, and that's how my mom and I would communicate. I get a little emotional with this, but the advice I'd want to give to somebody is to live. Just to live. Slowly things came back. Now I picked up my flute again, I'm playing again. I've gone dancing. I listen to music all the time. I watch movies. And so things came back very, very slowly, but they came back.
You have to be your child's advocate. You have to be there every step of the way, ask questions. And I will tell you that's the one most refreshing thing we found about Mayo was that they never got upset at our questions. They were always willing to answer our questions no matter how long it took. And no matter how many times we asked them.
Without my family and friends and the nurses here, the doctors here, other nurses and doctors and therapists and everybody, I wouldn't be here talking.
We tell Erin, you know, just stay strong and hopefully be a role model to other people, because, you know, she's the one that told me sometimes it helps helping other people.